Well, most of us are really hoping someone will come along with an effective vaccine for COVID-19 really soon. But the reality is, vaccines generally take about 18 months to develop. But there is possibly a faster way to do this, although it comes with some controversy. Today's guest is going to tell us what could be part of the solution. Josh Morrison is one of the team leaders with One Day Sooner. Hello, Josh. Thank you for joining us today.
Thanks for having me.
Now, can you give our viewers a snapshot of what One Day Sooner is all about?
Yeah, so we're a group that advocates for people who are interested in participating in what's called a human challenge trial. And what that means is it's a way of testing a vaccine that instead of just giving someone a vaccine and letting them go out in the normal population, seeing if they'll be infected, you actually deliberately expose them to infection, and that way you can test it a lot quicker. And so that's what we're interested in exploring, whether that would be a good idea.
Right. Now, can you explain how the human challenge trial works? I assume that first you find candidates or volunteers, right? And some of them are given the trial vaccine while others are getting a placebo, and then others actually get the dose of COVID-19 virus. Is that correct?
Yeah, no, that's exactly right. So it's exactly like a normal clinical trial for what's called efficacy to figure out if the vaccine works. So that's usually what's called phase three, and usually it takes if you're trying to go really fast, maybe 6 or 7 months, but often more than that, and has thousands or even tens of thousands of people. And like you said, you give half the group the vaccine and half the group a placebo, or maybe another vaccine or something like that that you're testing against. With the challenge trial works the same way. You give both halves the vaccine and the placebo, but then you have them come to a sort of medical facility where they'd be isolated and given medical care. And then they take like a nasal spray or something like that that has the virus in it and which will infect people who are unvaccinated. And hopefully, the idea is that it's calculated not to give serious disease to the extent possible. And hopefully, what happens is the people who are vaccinated far fewer of them show symptoms than people who weren't vaccinated, and that's how you test that the vaccine works. And you can figure that out within a few weeks or a month of starting that exposure, whereas for a regular trial, it might take many more months than that.
That's so interesting. So, once they're done with the isolation period, what kinds of testing will be done on the health of these individuals?
hmm That's a good question. So they'll be remain in isolation for several weeks until they've had several tests to make sure they're definitely not infectious, have no more of the virus, their health is back to normal, everything like that. So there's not going to be any possibility of reinfecting the community in any way or things like that. Now, after the fact, we would expect to have kind of longer term follow up and things like that to make sure that these people are getting the best healthcare possible, and any conditions that came up because of their brave acts, are going to be treated as well as we possibly can.
So, to what degree could this potentially speed up the timeline to get a vaccine out there?
Well, it's hard to say. There are some experts that propose kind of replacing those traditional quote phase three trials, those sort of 6 month trials, with these which might take maybe 2 months or so once they're set up, although it takes some time to get these challenge trials ready because they wouldn't be ready today. So in that world, maybe you could save several months. And there is precedent for doing that, where the vaccine that Americans use for cholera when they're traveling abroad, called Vaxchora, was developed using a challenge trial to prove that it was effective. But I think that's a little bit unlikely that you're going to replace those trials altogether. Instead, what I think we should expect is if this works, maybe it could save maybe as much as a month of a vaccine because you would get sort of the information you get out of a challenge trial is very useful, but it's not perfect. It's not a perfect replacement for that phase three because the people who participate in a challenge trial are young and very healthy to minimize their risks, and they're getting the virus in an unusual artificial way from like a nasal spray. So I would say, if things go well, a month could be a realistic goal for these challenge trials, though some experts have proposed even longer than that, as many as 3 or more months.
But that's still very soon compared to the 18 months, obviously. So, obviously, part of this debate would be whether it's ethical to intentionally infect someone with COVID-19, right?
Right, and that's, it's obviously an important question, and no one is underestimating or underplaying the risks to these volunteers. But at the same time, we think that if there are young and healthy volunteers, these risks would be around the level of childbirth or kidney donation, which are things that, are definitely significant risks and are real meaningful choices, but are also things we commonly allow people to do. And the benefits would be significant. So we feel like if there are willing and well-informed volunteers who want to take this risk, and it looks like there'll be a meaningful improvement in vaccine development, even bringing things 1 day sooner, we think would justify doing this
Yeah, and I'm
ethically.
sure that there's others that believe that this, in fact, might be morally required under the current circumstances, right? So you got two schools of thought there.
Yeah, I think and there's actually a paper, the World Health Organization just issued a report, I believe yesterday, that looked at these questions and came up with a set of criteria for how you would actually evaluate whether challenge trials would go forward. And I think, there's some things I disagree with, and there's some comments I made that I wish they had taken. But I think generally it's a pretty good report, and it's definitely something that's, I think, reasonably positive about challenge trials overall. And there's actually another piece coming out today by a number of bioethicists in the journal Science about challenge trials that's also fairly supportive. So I do think from an ethical perspective, there's a decent amount of support for this. I will say that, practically, it's going to be, there are some difficulties in actually creating these challenge trials, and it's going to take some time. And that's why we need to be doing everything we can today to be preparing these challenge trials so that if we are going to use them in 6 months, they're ready and available
hmm
to be used.
Now, if the human challenge trials aren't allowed to move forward, I guess we have to ask the question, how many lives could be lost because of the delay, either from COVID-19 or deaths from the effects of isolation and delayed surgeries?
Yeah, so I mean, it's obviously very uncertain, what things are the world's gonna bring in 3 months or 6 months, or especially, 18 months when a vaccine might be, kind of actively being deployed. And so anything that we can say is sort of a guess. And also again, we'll just say that, there's a world in which challenge trials shouldn't move forward because they won't work, right? And that is a possibility. And so we do have to recognize that. But that said, if you think about what does 1 day of vaccine deployment mean? One very, very rough estimate I use is I say, well, let's say that 1 out of 6 people in the world are going to get infected with COVID-19 every year. And let's say that a vaccine could save, let's just say 0.2% of those people from dying, right? So 1 in 500 of those people from dying. That would save about 7,000 lives per day and tens of thousands of lives per week, hundreds of thousands per month. So obviously that's an enormous effect, and that's why we need to do everything we can to prepare these and make sure they're available if they're going to be a good
Wow.
option.
Now, I'm curious, how many candidates do you have at this point, and do you have any idea as to when the government will give the okay for these trials to start?
So we've actually had as many as 14,000, more than 14,000 people sign up on our website who are interested in doing this. And they've come, it's really a global effort. It's people have come from more than 100 countries. Um, and I will say that the United States has a number of volunteers, more than 4,500 last we checked, but actually is only number two in the world. So Brazil has over 6,500
Wow.
volunteers. So it's been really incredible. Now, to your question about when the government might do this is something we're working on. We've been talking to people at the NIH, and we've been talking to Congressman Bill Foster, who's a champion of this and is a scientist himself. And so we're trying to secure funding in the next stimulus bill to pay for this preparation so it can move forward as quickly as
Wow.
possible.
And now, what kinds of people are volunteering? I'm just so curious about them. What age groups do you have, and what are their backgrounds?
Yep. And so I'll say first, we haven't done a kind of formal statistical analysis of this group yet. So the things I'm about to say are just impressions based on the reasons people have given for volunteering. What we find is it seems like most of our volunteers are probably between ages 20 and 35 or so, which makes sense because that's likely roughly the group of who's going to be eligible to do this. Though there are older volunteers, and I find their stories very touching because they often say, I know this is a greater risk for me, but it might be, more worthy for science, and I want to move forward and do it. The other thing I would say about our volunteers, and again, who mostly in that younger age range, often talk about that they're in good health. They also seem to be quite well educated. I think most of them are probably kind of young professionals or have some graduate education, graduate school, things like that. And often a lot of them have like a medical or public health or biomedical sort of background. And so they're kind of interested in these topics before. The last thing I'll say is that there are a number of volunteers, certainly not the majority, but a noticeable group who have military service and see this as being aligned with that, which I think makes a lot of
That is
sense.
so interesting. You mentioned hearing some of their stories. What are some of the stories that you are hearing from them? Why are they volunteering? I mean, you kind of explained that a little bit, but
Yeah.
I'm just curious.
So one that really touched me, there's a number of different inspiring stories, and I actually print out really that kind of read some kind of randomly and print out some of the ones that really connect with me. One that made me cry when I read it was someone who had been in an accident a few years ago they had lost part of their leg, and it really affected their life and really hurt their life. And they said they wanted, they knew that maybe they'd be ineligible because of this or because they were a bit older. But they really just were completely passionate about doing this because they wanted to be useful, they wanted to be making a difference. And this person had a 13-year-old daughter and wanted to do it
Oh,
for her.
wow.
And so that was one that really
Wow,
touched me.
that is touching. So, how much of a health risk are these volunteers realistically being exposed to?
Mhm. So, one thing I'll say, and one of the things that's daunting about this and makes it, a significant decision, is there's some real uncertainty. It's a very new disease. We're learning new things every day, and hopefully we'll learn more, by the time that it happens. But our best available data is that if you look at people ages 20 to 29, um, basically the risk of death in that group from COVID-19 is about 1 in 3,000. And that's including both people who are healthy and who have pre-existing conditions. And so with the challenge trial, you'd be removing people who have pre-existing conditions. And so that, if you look at, for example, the statistics from New York City, deaths between people 18 and 45, something over 80% of those deaths are people with pre-existing conditions. So the risks are real, but by comparison, about 1.5 in 10,000 women die during pregnancy. So this is kind of, I think, roughly on par with that. So significant, but also, when people are pregnant, we don't think like, oh, I better, say my goodbyes because,
That's
you
right.
might not be
Oh.
here. So it's real, but it's also, within a level of risk that we accept in other
And if the
circumstances.
trial is successful, will there possibly be some testing done on volunteer healthcare workers to put, those that are basically in a higher risk category to put them into a higher risk testing phase, so to speak?
Yeah, so there's a few different ways you could do this. You could select people for the trials based on people who had high risk before, like a healthcare worker or like someone who was in an area with widespread disease. So that's one thing that you could do. Another thing, is that's an alternative people have proposed to challenge trials, and I think it's a useful thing to be doing either way, is to conduct some of these clinical trials among healthcare workers. So, for example, there's actually a phase 3 trial now of a tuberculosis vaccine that they're trying to see if it works for COVID as well. And that's being tested in about 5,500 healthcare workers in Australia and the Netherlands. To be clear, that's not a challenge trial, that's a more conventional
Now,
trial.
some are suggesting that intentionally infecting healthcare or healthy volunteers, rather, with low doses of the COVID-19 virus could help create herd immunity, which could potentially make the pandemic easier to manage. So, what are your thoughts on this?
I think of that as a very separate proposal to what we're saying, and I don't really have particularly intelligent thoughts. What we're describing is something that is testing a vaccine and is being done, by medical professionals with the highest standard of care, with an enormous amount of preparation. I haven't seen anything like that among the other approach of trying to get immunity or things like that. So I just see them as very, very
Okay,
separate
and how
ideas.
are volunteers? How are you finding the volunteers? You mentioned earlier that they're actually finding you, right?
Right. Yeah, and I'll say that we're described sometimes as a group that recruits volunteers, but I don't think that's quite right. Because it's not, we're not trying to make a hard sell to people and say, hey, you should do this. We think that it's something that some people feel called to do and feel inspired to do, and that's the way I felt about it. And so I think people hear about us, and some people wanna sign up, and that's how people have been finding us. Our job isn't to try to grab volunteers. Our job is to try to represent those volunteers and advocate for them, basically making sure that if challenge trials are going to be useful, we do everything we can to make them happen, while at the same time making sure that they don't happen if they're not going to be helpful, or if the risks are unreasonable compared to the benefits. So we're trying to advocate for those volunteers, but our goal is not necessarily to try to get as many people as possible to do this. We think it's something that if it feels like the right decision,
Hmm.
that's wonderful. And if it doesn't, it's certainly not for everyone, and we would never, try to,
Of course. Right.
sneak
Yeah.
someone
Thank
into
you for
volunteering.
clearing that up, too. Josh Morrison, thank you so much for being on our show. We really appreciate the information here.
All right, thank you for having me.
All right. That is Josh Morrison. He is one of the team leaders with One Day Sooner.